Breast cancer. Breast cancer, risk factors and safety precautions. Today's woman is more knowledgeable and conscientious than ever about the risks of breast cancer. This is especially true for women over 40 years of age, who have crossed the threshold of increased risk of breast cancer. Age is so important to the development of breast cancer that about 76% of women who develop it have no other risk factors other than age. However, all women, regardless of age or race, need to acknowledge the risk of developing it. All women are at risk. Breast cancer information is important. Breast cancer usually happens when certain cells located in the breast start to grow out of control, taking over nearby tissue and spreading throughout the body. Large collections of this infected tissue are called tumors. Some tumors are not even considered to be cancer because they cannot spread throughout the body or threaten a person's life. These types of tumors are called benign tumors. The types of tumors that do spread throughout the body and invade the tissues around the breast are considered to be cancer and have been given the name malignant tumors. It is said that any type of tissue in the breast can form some type of cancer, but it mostly comes from either ducts or glands. It can take months or even years for a tumor to get big enough for someone to actually feel it in their breast, so they are encouraged to be screened for tumors by a mammogram. Mammograms are designed to detect any type of disease before a person even begins to feel it. Breast cancer is the most common malignancy that affects women in America and throughout Europe. Every single woman is at risk of getting breast cancer, and almost 200,000 cases were said to be diagnosed in the United States in 2001. It is the second highest cause, behind lung cancer, of cancer deaths among women in North America. The types of risk factors for breast cancer are divided into two types: those you can't change and those you can change. The factors associated with increasing your risk of breast cancer that you can't change include just being a woman, getting older, or having some type of family history or a relative with breast cancer. Other risk factors are having your menopause late, having children past the age of 30, or contracting a genetic mutation that would somehow increase your risk. Risk factors. Women who have never smoked a day in their entire lives can develop breast cancer. Women who have always been health conscious can also develop it. In fact, nearly 1 woman out of 11 will experience breast cancer. A staggering statistic by anybody's standards. An estimated 211,000 new cases of breast cancer was diagnosed in 2006. Even with the increased awareness programs, early detection through annual mammography screening and instruction for self-examination, breast cancer remains a leading cause of death for women. Breast cancer, like other forms of cancer, is a disease of the cells. In all, there are about 15 different types of breast cancer. Some are more serious than others, but the one common factor each shares is that neither the cause nor the cure has been found. These are the most probably breast cancer risk factors. 1. Last researches have established that in the age group above 50 years there is a high incidence. On the other hand, in the age group below 25 years the incidence is very low. It is very important to say that this disease is very aggressive in patient 25 to 50 years old. 2. Menstrual cycle is other factor that should be considered, common in the ladies who have a longer menstrual life, i.e. the onset of menarche is earlier and cessation of menstruation is late. 3. The women that smoke and drink alcohol increase the risk of developing breast cancer. 4. Breast cancer is developed more frequently in spinsters and married women that have not given birth to children, or if given birth then have not breastfed their offspring. 5. The women that have had a breast cancer on one side have greater risk to develop cancer on the opposite side, and if there are antecedents of breast cancer in their families, mother, sisters and daughters, there are greatest risks too. 6. Breast cancer is linked with obesity and higher intake of saturated fatty acids. 7. Breast cancer is linked too, with the continuous or sequential uses of combined estrogen plus progestin hormone therapy (CHT). 8. Women that have been using oral anti-contraceptives for more than 10 years are more vulnerable to the development of this disease. On the other hand, women doing 4 to 5 hours of exercises per week reduce their risk of developing breast cancer. In short, these facts derive from the statistical analysis. They should not be taken as causative or predisposing factors. There are 4 recognized developmental stages of breast cancer. 1. State 0 – Cancer cells are present in either the lining of the milk glands lobules, or in the tubes ducts that link the milk glands to the nipple. No cancer cells have spread to the nearby fatty tissue. 2. Stage 1, cancer has spread to nearby fatty tissue in the breast. Tumor size is about 1 inch or under, no cancer cells are present in surrounding lymph nodes. 3. Stage 2, size of tumor is 1 inch to 2 inches in diameter, cancer cells may have also spread to nearby lymph nodes. 4. Stage 3, cancer is locally advanced. Tumors are approximately 2 inches or larger in diameter, or tumors of any size have spread to lymph nodes under the arm or in the chest, above or below the collarbone. 5. Stage 4, metastatic, advanced breast cancer. The cancer has spread from the breast and lymph nodes to other parts of the body. Early detection of breast cancer remains a woman's best chance of survival, and women of all ages should take advantage of all the resources available. Every woman should. 1. Become educated about the risk factors associated with breast cancer. 2. Become knowledgeable about the types, stages, and symptoms of breast cancer. 3. Learn the correct procedure for self-examination tests, and perform them routinely. Long-term use of oral contraceptives, early menstruation, late first full-term pregnancy, exposure to high doses of radiation, puberty through childbearing years, and inherited genetic mutation can all increase a woman's risk of acquiring breast cancer. Women 40 years of age and older should also 1. Have an annual mammography screening. 2. Become educated about increased age-related risks associated with breast cancer. Recent studies confirm that risk of breast cancer in midlife increases with regular consumption of alcohol, hormone replacement therapy, weight, and body mass distribution. During self-examination, look for a lump or thickening in the breast, a discharge from the nipple, or around the nipple, a change in shape, color, or texture, and dimpling or puckering. If you detect a lump, don't panic. About 85% of all lumps turn out to be non-malignant. Make an appointment with your doctor for a more thorough examination and tests. Treatment for breast cancer today is often less radical than in years past, and chances for survival much better when the tumor is discovered early. Breast health: 8 things every woman needs to know. I always advocate self-care as the first step in preventing and treating health challenges. When it comes to breast health, the importance of self-care is a message I can't share often enough. It is great to see pink ribbons everywhere in October during National Breast Cancer Awareness Month. If I had my wish, every pink ribbon would carry an additional important message for women. That message would read, "You can improve your breast health and reduce the risk of breast cancer right now with a few simple lifestyle changes." We may not be able to control where we live or our genetic risk factors, it's true. However, a growing body of research is showing us that women really can make a difference in their breast health through diet, exercise, and weight management. These simple steps can help optimize your body's hormonal balance and reduce the risk of developing breast cancer, and provide additional health, anti-aging, and disease prevention benefits. We need to emphasize that everyone should be focusing on what we can control, not what we can't. 1. We can evaluate our hormone levels with a saliva test. The best way for premenopausal and postmenopausal women to know if their bodies have an imbalance of estrogen, progesterone and testosterone is to do a saliva test. Saliva testing is the most accurate and easy way to this. 2. We can use bioidentical hormones if we need hormone supplementation. Bioidentical means that the molecular structure of the hormones identically match the hormones made by our body, as opposed to pregnant mare's urine, which is natural to horses, not humans. 3. We can change our habits, reduce alcohol consumption and quit smoking. 4. We can manage our weight and exercise daily. Studies also show that maintaining a healthy, average weight is just as important in favorably influencing the estrogen-progesterone ratio. Regular exercise is equally important. On the other hand, obesity, high insulin levels, alcohol intake, smoking, oral contraceptives, hormones from meat and meat products, pesticides, and herbicides can swing this ratio in the wrong direction. 5. We can eat a balanced diet, choosing eat organic to avoid pesticides, herbicides, and estrogens in meat and dairy products. Include 1 to 3 servings of cruciferous vegetables like broccoli, bok choy, cauliflower, Brussels sprouts, and cabbage in your diet each day. Studies show that indole 3-carbinol, the active ingredient, helps balance estrogen levels. 6. We can supplement wisely with EFAs, essential fatty acids, and use a fruit and vegetable concentrate if you do not eat 5 to 8 servings of fruits and vegetables daily. 7. We can do BSEs, breast self-exams, becoming more familiar with our own body. 8. We can become better informed, read Dr. John Lee's What Your Doctor May Not Tell You About Breast Cancer as a start. Thank you for watching. I do hope that this video gives a valuable information to you.